Good afternoon, everybody. It is Tuesday in the midst of our war against the coronavirus. And let's remember, we are at war with this virus. It has come to take the lives of our people, to try to turn everything about our lives upside down, and it's our job to fight back. This is a war fought not by individuals who volunteered or who were drafted. It's fought by every single one of us. Whether or not we want to be in this war or not, every single individual's actions matter, and we need everybody's help. And it continues to ravage the citizens of different states around this country. Today, again, tough news for Florida and for Texas. Florida now with most cases of any state, and what we see is after you have high cases, you start seeing high numbers of deaths. Florida setting a record for deaths in a single day, and in Texas, every 6 minutes and 16 seconds, they're losing someone to COVID-19. That tells you when we have days of high case numbers, this is what follows. But again, we are at a point in time where we have the ability to stop this before it gets anywhere close to what we've seen in those states. And around us, in other states, we are starting to see, or we've been seeing, an escalation, again, that looks to be more significant in magnitude than ours. Again, saying that if we don't take action, if we don't all buy in and do our patriotic duty to stop this virus, that we will continue to have significant loss. I believe Tennessee reported over 2,500 cases today, and Oklahoma, a state with less population than Kentucky, has reported 1,000 cases, new cases, each of the last 3 days. So we're not unique in what we're facing. And in fact, the point we are at right now, those two states were at probably a short time ago, and Florida, Arizona, Texas, Alabama were at before that. Our goal, and I think what we have done, is to act quickly, to not let it get dire before we take the steps we need, and to fully commit to doing what it takes to protect our people, keep our economy open, and ultimately get our kids back in school. As you know, we've recently taken 4 steps that are fully endorsed by the White House. They believe that this is the way for the states that are suffering very badly right now to get out of what they're seeing. They believe it's also the way, and we agree, the most effective way to stop the escalation that we're seeing right now. Those 4 recommendations, which come from the COVID team, the White House, the Vice President, just on a phone call right now, repeated them, and that they are the official recommendations of the administration. And we agree here and have now put each and every one of them in place. Or number 1, a statewide facial covering or mask mandate. Dr. Birx was clear. Needs to be statewide, needs to be required, and we agree. If we can do this, and actually we're going to see today, our numbers didn't escalate really from yesterday. We think we may already be seeing an impact of this. Wear that mask. It's going to be the best way to get back to our old normal or something close to it. Number 2, limiting social, non-commercial gatherings to 10 people or fewer. Again, this is absolutely critical because we see lots of clusters in our backyards or in our house parties. And folks, I can't control what everybody does out there, so don't look for an excuse on this. I get that you might look and see people that are out marching or protesting and say, well, there's more than 10 of them there. If our response to this is if every other person isn't doing it, we're not going to do it, then there's no way that we're going to make it through. We need everybody to do the right thing because it's the right thing and not look for a way out of it. So please, 10 people or fewer, we're asking you for the health of our people, for the health of our economy, and for our kids' education to follow that. Other two steps we took yesterday. Bars closing for 2 weeks, and again, that's effective as of today, and limiting indoor restaurant capacity to 25%. Outdoor capacity can remain as long as there's social distancing. Those 4 steps are critical, but let me add one. We put up the travel advisory. At this time, when we're losing more people, when we know we're going to lose more people, when we've got to get control of this, I'm still learning that folks are going to the beach. In a place like Florida, where we just listed, they have the most deaths of any state has ever had in a single day, and people are going there. I keep hearing stories about extended family of my friends, thinking, well, if they just stay together, they could even take mom or dad down there. And now mom and dad are gone. Another member of the family is in the hospital, and many more are infected. We don't get to take breaks from this thing, and we cannot travel in these areas. All of you out there want to get our kids back in school, but just imagine, if we can start doing that safely, what happens when one family travels to a state like this? I need everybody that has plans to go to Florida or Georgia, Alabama, South Carolina, Texas, Arizona, cancel them. I actually talked to some people last night that had canceled their plans and they're going to Kentucky Lake. That both helps our economy, but it's also the right thing to do. Now is the time where we are calling on you as citizens of this Commonwealth to protect each other, and those are the 5 steps that you can take to make sure that we do it. Again, this travel thing is important, and just imagine that business that's trying so hard. I talked to one of our major businesses, one of our industry leaders the other day, and they said, Andy, we've done everything we can in our factory. We've got all of the best procedures in place. We even know where people eat lunch so that we can contact trace if we have an infection. And people going on vacation to states like Florida keep bringing infection back into our facility. That's got to be really frustrating for them trying to do the right thing. Let's make sure we don't frustrate those overall efforts and ultimately push us backwards. So today's update is well, 2 weeks ago would be something that we wouldn't want to see, but it at least gives us hope that we may be seeing a new plateau or stabilization. It is too early to come to that conclusion. But today we're reporting 532 new cases of COVID-19. I believe yesterday was 522. Certainly the last 10 days, that is below our average. And what we have seen in the last 10 days is you'll have a lower number, you'll have a couple days of something else, and then you'll have that large number. 532 cases, again, not where we want to be, but it's out of 10,325 tests, which means our positivity rate is now 5.08%. First time it's gone down in 4 days. Again, too early to draw conclusions, but I hope, I'll just say it, I hope that this is us starting to see, because the time period is right, where the facial covering requirement is starting to kick in and help. Our number of Kentuckians hospitalized and in the ICU is also down a little, though sometimes the ICU number is down because we've lost people. We have 584 people currently hospitalized for the coronavirus. We have 115 in the ICU, and we have 7,470 at least that have recovered. We now have 28,126 total cases, of which 1,470 are probable. The rest are lab confirmed. All right, new cases by county. Again, Jefferson 130, Fayette 27, Kenton 24, Madison 19. We've seen more cases in Madison certainly over the last 14 days. Warren 17, Barron 14, Graves County, again, Graves is in the red zone in the White House analysis, 14, Boone 12, Harlan also, I think, in that red category now for how quickly it's happened. 12 new cases there. Christian 11 and Laurel 10. A lot of other counties here. They're all posted on our website. We continue to see a lot of cases with kids under 5. It's 21 kids under 5 today. It's a trend that I think we're seeing around the country. I think that part of it is that we didn't test as many kids under 5, but I also at this point think that we have more young children getting the virus than we did before. We can't live under any illusion that kids don't get the virus. And the more and more kids that get the virus, even if the percentages of those that are harmed are low, that's just a math equation. More kids who get the virus times whatever that number is of those that are harmed equals more kids that are harmed. I don't want that to happen to any of ours. The youngest today is 2 months old. That's something we want to make sure we turn around. While our numbers, again, higher than we like, but at that number, really close to yesterday. While we hope that what we see tomorrow suggests that is a changing of our trend, our total number of deaths are up today. We're announcing 10 new deaths to COVID-19. That brings us to 719 total deaths here in the Commonwealth. They include a 74-year-old woman from Butler, a 101-year-old woman from Logan County, 83-year-old man from Logan County, 89-year-old woman from Logan County. Logan County has been hit really hard. They've lost a lot of people. 87-year-old woman from Jefferson, 84-year-old man from Fayette, 82-year-old man from Jefferson, 73-year-old woman from Oldham, 86-year-old woman from Jefferson, and a 37-year-old man from Lyon. I believe he was incarcerated in the facility down there. So we want to turn our numbers of cases around, but let's remember, any day we have a significant number of cases, right now we got about a 3% mortality rate. High cases means we lose more Kentuckians. There's no way to get around it. And while we'll fight to lower that mortality rate, it still means more Kentuckians are at risk. And every time we do something that spreads the virus, again, it exposes more people to that potential outcome from which they cannot recover. Ethnicity and racial statistics are almost identical as yesterday. We will put them up on our website so that everybody can see those. We update them every single day. Long-term care continues to be a problem area. 77 new residents and 31 new staff tested positive. 9 new residents have died, at least that's attributable to them, and 3 new facilities. We are talking internally about how to refine our reporting here, because we've got 247 facilities up here. They don't all have active cases right now. The vast majority of these facilities have been stabilized, and so we're going to try to look at how we can both give a picture overall like we do with the total case count, but also try to find a way in that data to say, but here is what we're facing right now. If we're seeing better news, I think it's because our people out there have been working really hard. And I've been committed in these more dire times, and we are still in some dire times, to trying to show the positive that's out there, those that are going above and beyond and filling up social media with those positive examples of the good things that are happening. If you're doing the right thing, you're not getting out of the house as much as you normally would, so you won't see as much of this. Let's start with Flavorman, one of our Kentucky companies that has been working hard for weeks to provide sanitizer to critical facilities all over Kentucky. This is a Center for Women and Families, a rape crisis center, and a shelter, all in one, that's been doing amazing work for families for so long. And our current DCBS commissioner used to be the director there. Let's look at our second one. Good chance to get out with the kids. This is pretty special, and you can actually see my office from here. I appreciate having them at the Capitol, but I also love this picture because we can have good moments. We can still connect with our families. We can spend more time with the people that we love and at the same time be doing the things to stop this virus. Again, it's hard, it creates anxiety, but if you compare it to many challenges in the past, less is being asked of us. Let's make sure that we rise to the occasion and do the things that we need to do. All right. I remember this polar bear when it was just a cub, bringing my kids and so many other kids to the zoo. You can see here, even though they're outside, knowing how many people you're going to interact with in the zoo, these kids are doing the right thing, wearing a mask, and enjoying that zoo. I think this is one of our gems. Our Louisville or our Kentucky Zoo is one of our gems here in Kentucky, both for our Kentucky citizens and for those that typically would travel in. And if you're looking for, again, a in-state Kentucky vacation, I need you to be doing that instead of going to Florida. Go see the zoo. Support it. It's a great institution. All right. And I think this is Monica Hardin's kids who have gotten in on the chalk art. They have done an incredible job. And again, this is going to bring a lot of joy to those that come past it. We got a special treat today. We've got folks out there spreading the word on masks. And today, this wasn't one that I'd specifically asked for. I ran across a video of our current Miss Kentucky, specifically talking to kids about when we are back in-person classes wearing a mask. And I can't thank her enough for doing this, and we want to show it today.
Hey everyone, I'm Alex Franke. I'm Miss Kentucky, as you can see, and I just wanted to share a very special message with you guys today. I'm talking a little bit about something that we've all gotten really used to by now, which is wearing a mask. Now I get it, wearing a mask is not a lot of fun. It can be really hot, it can be sweaty, hard to talk, you can't really eat with them on. I get it. Wearing a mask is not the most fun thing we could be doing. Wearing a crown is definitely a lot more fun than wearing a mask. But when I go anywhere, I wear my mask to make sure I can protect you. My mask isn't about protecting me, it's actually about protecting you. So I wear a mask because when I'm out, I want to make sure I'm not passing COVID to anybody that I care about, because I may have it and not even know about it. And you might be saying, Miss Alex, if I got COVID, I think I would be okay. I think I'd be able to recover. And I'm sure you would. But the chances of you passing it on to somebody else who couldn't recover are really high. You might pass it on to your friend at school, your friend's family member, your teacher, somebody else who works at the school, and they would be a lot sicker than you would be. We're all different. We all have different needs. But if we're all going to take care of each other, there's one easy thing that we can do, which is to wear our masks. Now make it fun. Get your favorite print, your favorite character, put your name on it, make it sparkle if you want. Turn it into a fun project so you can decorate your own mask with your family. But just remember, we're gonna have to wear these at school all the time, so make sure you're being a good listener and a good neighbor by following the mask guidelines and listening to your teachers when they remind you that you've got to keep them on. Now I'm gonna keep my mask on, and I hope to see you guys out with yours on too. Don't forget, let's mask up, Kentucky.
I think she does that much better than I've ever been able to. And I think has also in the past served as a math tutor, which I think every parent in Kentucky now needs. All right, as we are dealing with COVID-19, we are also seeing historic calls for racial equality across the United States. And today marks the 53rd anniversary of the formation of the National Advisory Commission on Civil Disorders, better known as the Kerner Commission. That was an 11-person commission created by Lyndon B. Johnson, and it had the explicit purpose of discovering the root causes of civil unrest and subsequent violent disturbances that occurred in the summer of 1967 in many cities across the country. The commission was asked to answer what happened and why, and how to prevent it from happening again. The results of the investigation were a conclusion. Our nation is moving towards two societies, one black, one white, separated and unequal. There were many recommendations that came out of this report, essentially a roadmap to equity that were largely swept under the rug and never addressed. Much of our civil unrest that the nation is currently seeing over the past months, many think mirrors 1967. At that time, President Johnson announced that the root cause of the condition should be addressed, not because we're frightened by conflict, but because we are fired by conscience. Today, 53 years after his call for answers, our nation is still struggling with racial inequity, as history continues to replay itself before our very eyes. Undoubtedly, progress has been made as a nation, but we can't deny the disparities still exist in every single part of our society and in every single part of our Commonwealth. Simmons College of Kentucky has recently announced the formation of the Kerner Commission 2.0, not to duplicate the work of the original, but to pick up the mantle and begin the work that was laid out. We want to realize the vision of an equitable Kentucky for all Kentuckians, an equitable Kentuckian for Black Kentuckians. I'm proud to recognize this noble and timely effort, and on today, the 53rd anniversary, I'm offering my support to the work of the Kerner Commission 2.0. Currently, there's work on naming the commissioners, and we're going to convene this as a statewide brain trust. Try to make sure that it's not just voices that are expressing frustration, but it's true change being made. Special thanks goes out to Dr. Kevin Cosby for his commitment to finish this great work that was started more than 50 years ago. I support it because it's important, and it's time. It's way past time. And this is one commission, certainly of incredible leaders, that I think are going to help us not just talk about inequity, but to truly begin to address it in meaningful ways. All right, we are going to go questions a little early today and hopefully get everybody out. We've got a semi-full rotunda, and then I've got about 3 written questions that are here. I think I started with you yesterday. All right, Joe. Just trying to be fair.
In terms of the overall number of cases, I know we're talking about child care facilities, and we've also been talking about the number of tests, positive tests for kids under 5 years old. Are there any, as far as the 2, are they correlated in any way, or are there seeing specific getting these at child care facilities, or are they just getting infected on their own?
We don't have, the question is, do we have data on where the children are getting infected, whether it's daycares or other areas? I don't think we have enough data on that yet. Certainly, we know one driving cause is people going on vacation and taking their kids to places that they shouldn't be taking them, and then coming back, and then their kids interact with other kids. Now, we know that children can spread the virus. There is some question, depending on age, as to how much they spread the virus, but the more contacts that children have, the more likely they are to get the virus. And the more contacts their parents have, the more likely they are to get the virus. And so we're carefully watching daycares. It's why we have the rules that we have in place, and maybe we can work to try to refine those as we move into the future. But we got to be really careful, especially with our youngest Kentuckians. Tom?
The governor's looking at the ACC website this afternoon at the Career Center, and there are no locations for people to go to that are having issues with their unemployment. The one here in Frankfurt is like booked through the month of September, and the 2 other cities, Prestonsburg and I think the other one right off the top of my head, show that this event does not exist. Where do we stand?
The question is about in-person unemployment. We currently have a Frankfurt center, but you're right, they are booked. During the last 2 weeks, we've pulled our people back in so that we can get through that last step we talked about of getting the claims that EY has gone through that final step. We have 63,000 claims that are 95% done, but the federal government makes us write a 2-page letter that's basically an opinion that we need to have the people that manage those in-person sites, they're directly working on. I do believe we will have an announcement this week about in-person services next week. We're finalizing that as we speak.
At what point will you feel comfortable declaring the current trend a plateau, and what do you want to see in 2 weeks in order to roll back some of the restrictions on restaurants and bars?
So the question is, what will I consider a plateau, or what will Dr. Stack tell me is a plateau, and then what will I consider when we look at restaurants and bars? First, it's my expectation that we'll be able to increase capacity at restaurants again in 2 weeks. It's my expectation because I believe these steps will work, and we set that time period, especially for restaurants. We know it's hard. But 2 weeks give us a real opportunity, and our hope is that we see the impact of the facial coverings before we see some of the impact on restaurants. The first thing we've got to see is the positivity rate not continuing to increase. Overall tests, we want to see our number come down. Now, if they're up a little bit on a day where we have a ton more tests, that's reflected in the positivity rate. But we want to see both of those. I'd like to see multiple days where we don't have that one big peak, where we don't have the 800 or the 900. And then I'd like to see us start to go back down, because at least theoretically we should be able to start getting our numbers back down from the 500s. Will we plateau given everything that's going on in the country around us at a number higher than our previous one? We might. Again, this virus doesn't care about state borders or county borders, and so we're always going to be in a bit of a battle based on what's going on around us. But that's what we'll be looking for, and I'm hopeful. I'm hopeful, and I understand the businesses that are concerned about their future, and I want to get this right so that the next time we make a move, we don't have to undo it. But I mean, what's in charge here is the virus, and we're having to respond to it. We are likely to have to extend the facial covering mandate. Every public health official right now is saying, with what's going on in the country, this is the number one way that we can get back to our old normal. And if we're going to be able to increase our capacity in restaurants, if we're going to be able to take a run at opening bars again, facial coverings is going to be absolutely necessary. Karen?
Dr. Stack, there was a video that went viral last night that went up to several months ago talking about the hydroxychloroquine treatment again and all that drug treatment, with some doctors saying we should go back to that. Can you go over the official medical stance on that? I know the video's been pulled, but a lot of people are doctors' offices have even told me that they're getting calls
articles to try to keep current. So this morning I was looking at the New England Journal, and like many of the bigger journals, they have free access to their research and related to coronavirus. And look, I try to be careful. I try to be straight about when I can be certain and when I can just say it's high probability or when we just don't know. All the credible evidence I have seen so far is hydroxychloroquine and chloroquine are not materially helpful. They do not help enough to be worthwhile for coronavirus. They don't effectively prevent you from getting the disease after you've been exposed to it. When you're sick, they don't help you get better more quickly. When you're sick, they don't help prevent you from having a bad outcome. So maybe someday there'll be some example or some narrow situation where that's not the case, but hydroxychloroquine and chloroquine, with or without the antibiotic Zithromax, are not, which is known as azithromycin is the generic name, have not been shown to meaningfully improve your outcomes. And so unfortunately there's a lot of misinformation about this, and it continues to propagate people being confused about what is credible and what is not. The drug remdesivir, which is still experimental and is not FDA approved for the treatment of any human condition at this point, has shown some benefit for shortening duration of illness, but has not yet been shown clearly to improve your chances of living if you otherwise would have died. Dexamethasone, a steroid which has been around for decades. We use dexamethasone a lot of times for a lot of conditions. may be useful in some circumstances for people who are already sick enough to be on oxygen or on a ventilator, but has not yet been shown to be helpful just to give in general. Yeah, I mean, so look, people, when they are desperate or unwilling to listen to science and facts and evidence, do things that are foolish. Okay, people were taking aquarium chemicals and ingesting them because they thought that it was somehow going to help them with the coronavirus. Ingesting aquarium chemicals will kill you. It won't help you with the coronavirus. So please don't do those things. And the last thing with the governor, he's made these points. Like I said yesterday, we hate doing some of these things we have to do. Wear a mask. We want to keep businesses open, wear a mask. That is the single thing, if we just do it, if we get over the cultural divide about not wearing these things, this is how we keep businesses open, we keep people working, we get people back to the activities, we get kids back to school. Contact tracing, testing, and all those other things work when the disease is not common, when there's a few people who have it and you're trying to find ways to isolate them. When it's all over the place like it is in the state right now, the other stuff doesn't work, and we have to take these more difficult steps like we have this week with the recommendation of the White House. So please wear a mask so we can come back up here and tell you more often, Kentucky's open for business, people are back to activities simply by wearing a mask and staying a little distance from each other.
Okay, let me answer this question, and then we'll go to you. Don't go far. Let's see, we got a question from Louisville Business First. Is there any data available on coronavirus spreading at bars and restaurants in Kentucky? So our cluster data is only as good as the clusters that are reported to us from local health departments. We have a lot of them that are reported by some, not as much by others, but at least by what we have, at least 17% of the known clusters that we've seen in Kentucky are related to restaurants. I think our restaurants have worked hard, but the second part of this question is, why are they alone facing new restrictions while other stores and public spaces are not? It's because the federal public health officials, the state public health officials, all believe that this is the most effective step that we can take, and they see significant spread occurring in these facilities in Kentucky and outside. Again, this is everybody from the top down in public health that believe that these are the steps that we have to take. We got it in writing from the White House. We got it from Dr. Birx herself. I heard it again from the Vice President roughly an hour ago. I think this next question's for you.
Dr. Speck, can you talk about some of your concerns about people propagating misinformation about hydroxychloroquine? Of course, the elephant in the room is that the president himself has been promoting and touting hydroxychloroquine for months, and the reason we're having this conversation today is because he went on the tweet storm overnight sharing this dubious information about the drug and its efficacy in treating coronavirus. I know you don't want to get into politics, but do you worry that the president is undermining the public health message in Kentucky and across the country?
So I'm going to add, if I may, to what the governor said, and then I'm going to answer your question, and I'll repeat it for the audience so they know that. So the governor makes the point, there's a double-edged sword here, and I just want to call this out so people are attentive to this. Folks ask us, I think reasonably, can you be more tailored? Can you be more precise in what you do and get a bigger bang with less adverse impact for folks? The White House has recommended some very specific guidance. Specific guidance was wear a mask, keep social gatherings to 10 or less. It was also to close bars and then to restrict restaurants to 25% in person. They did that, at least they tell us when they visited with us, because in Arizona and other places, when they took those steps seemed to disproportionately help to tamp down the infection. And so if you look at Arizona's data, they went really sky high, and now they're coming back down. So I think what we've shown is when we take certain steps, we can control the virus, we can contain and minimize its spread. So when we stand up here, and I'll put it in the first person, when I make recommendations, when I ask the governor to consider these things, we try to do it because we're trying to be responsive to how can we find those measures that have the biggest benefit on minimizing the spread of disease and keeping people from the harms that come from it with the least impact on others. So it's not perfect. I've said that all along. It's not perfect. Now, the question you had is about when leaders and others choose to communicate however they do that, whether that's on social media or publicly, and communicate things that may or may not be supported by science. And I would just say I continue to urge everyone in the public, please find people who have dedicated their lives and their professional lives to studying and learning about these things that are important, and listen to credible sources. I would look to a physician or a public health expert to advise me on public health stuff. I don't take my car to a medical doctor to get fixed, okay? I don't ask a medical doctor to come to my house and fix my electricity problems and repair my roof, okay? Find the right expert for the right advice. In this case, I would say look at folks who surround themselves with people who dedicate their professional lives to advising on these kinds of things, and listen to those credible sources. And I'm proud to work for Governor Beshear and work with Governor Beshear, because I think he has done that time and time again. And so I would say, if you listen to what the governor's telling you, I think you're in good hands, not because I'm standing next to him, but because I got a team of hundreds of public health people, in fact, thousands when you add the local health department leaders, that we are working with every day trying to give you the right advice.
All right.
Said today that he's looking at possibly scaling back eligibility for mail-in voting on the general election compared to the primary, when it was no excuse for everyone. Is that something that would you sign off on any plan for the general election that scaled back eligibility to only a certain class of people to vote absentee?
The question is about the general election. I believe there was some testimony today, I didn't get a chance to see it, that suggested maybe a scaled back version would be offered by the Secretary of State, and I haven't received his official plan, so I'm just going off secondhand reports. I believe that with the virus more dangerous now than it was during the primary election, that we ought to have no excuse absentee voting. We ought to have early voting. We ought to have multiple locations on Election Day. We should look back at the primary and say it was one of the most successful elections that we had. And if that's the case, and it was a successful election during a pandemic, why would we back off of it? Most of the time when you have success at something, you then don't do 75% of what you did to have success. So I'm going to wait to see the Secretary of State's plan, but I will certainly push hard for no excuse absentee voting, and I think everybody out there likes it too. It lets you get it done. It lets you get it done from the safety of your own home. I believe that Democrats and Republicans voted heavily absentee, and the more people who vote, the better. It's supposed to be the bedrock of our democracy. Let's increase voting. Let's not decrease it.
We hear you talk a lot about people still leaving Kentucky to go to beaches and take their vacations to Florida and South Carolina. But the reality is there's a lot of people that are coming into Kentucky from Florida, South Carolina for actually their own vacations. So what's your message to those people?
With our travel advisory that's out, we are cautioning people both from traveling to places that have a high rate of the coronavirus. We are also concerned about people coming from those locations. If you're going to come from a state with above a 15% positivity rate, my hope is that you took a test and it came out negative before you come into this state. We all have an obligation not to spread it. And I will tell Kentuckians that if we hit that mark, that we shouldn't be traveling other places. Because if we end up in this spot, I don't want it to happen to anybody else. I don't want what's happened in Florida to have happened to Florida. And so we need to all take that responsibility for what's going on around us, even if we don't believe that we personally are the cause of it. A question that Secretary Freelander can answer, it's about, with the rise of COVID-19 cases, am I anticipating extending the temporary Medicaid that's set to expire August 31st?
Thank you, Governor. So temporary Medicaid is available to individuals who are uninsured in Kentucky. When you sign up for that, you can get up to, well, between 5 and 6 months of eligibility. What we are doing is that we are reaching out to every individual who has gone through the temporary Medicaid, we call it presumptive eligibility, and we are reaching out to every individual, and we are trying to get them now enrolled into regular Medicaid. And once you're enrolled in regular Medicaid, that is income-based, and as long as you need that coverage, and as long as your income says that you are eligible for that coverage, you will receive it. So there's really no need to extend that. We will be reaching out and trying to get everybody into regular Medicaid.
And let me compliment Secretary Freelander for his work. When people have really needed our help during this pandemic, there's 3 things typically that can be needed: unemployment, and we need to do better than what we've done. The other 2 are potentially what we call SNAP benefits, which is food assistance, and Medicaid or pandemic Medicaid, which provides health care services. And I believe both the SNAP and the Medicaid services and sign-ups that we have done have been success stories. And in many instances, I believe that we have done significantly better than many others across the country.
I want to go back to the kind of confusing nature of what's happening with evictions. Have you had any contacts with the state Supreme Court over their decision or announcement yesterday that eviction proceedings are starting? It seems to be conflicting with your mandate statewide.
The question is on what is a confusing situation on evictions right now. We were surprised to see that evictions were included in the new order in the Supreme Court. Our attorneys that are involved in the Northern Kentucky lawsuit has reached out to discuss it and begun discussions on it. The mediation that we are in, that the Supreme Court is going to participate in, is active. I know that there have been some possible outcomes that have gone back and forth, trying to find that right area where no one who is unable to pay because of COVID is evicted, but at the same time those that can't use it as a reason to simply not pay. But it is confusing, and we're trying to work through it and trying to discuss with them what their rules mean in light of our order.
What do you tell people who are either on either side of this situation, really, either tenants who are concerned about possibly getting evicted or landlords who are concerned about tenants who fall into that category who may be able to pay but just haven't?
Well, I think where we are right now is that an eviction proceeding could proceed, but whether enforcement could come on the back end of the eviction itself is probably stayed by our order. But we all need to get on the same sheet of music, and that's our goal before any of those deadlines come up. You're right, it has created a confusing situation. Our job is to resolve and solve it before anyone would face that outcome. Tom? I will say we have in our discussions learned that the numbers of Kentuckians being faced with this is much lower than we thought. The vast majority of Kentuckians are already on a form of a payment plan with their landlord. I believe that there are some circumstances that are out there. I do believe that it is significantly smaller than many anticipate, and because of that, my hope is that we can get it right on each and every one of those so that our people don't suffer. Tom?
Today, actually, again, threatened to burn the bull to the ground in 4 weeks, which is the Breonna Taylor case is not investigated. Any thoughts on that?
And nobody should be threatening to burn any of our cities to the ground.
Said that cases in Louisville are rising, Jefferson County are rising at an alarming rate with the word that she used. What's your reaction to that? And do you anticipate any additional steps maybe in Jefferson County or its particular hotspot?
The question is on Jefferson County, where their head of public health, Dr. Moyer, very accomplished public health director, talked about cases rising at an alarming rate. I think used the word wildfire. that has been used in other states. We believe that the steps that we have put into place, these 4 steps, are going to be effective all over the Commonwealth. The White House agrees that we need to do it statewide. I believe that they will be particularly effective in Jefferson County. The degree of how effective they will be depends on how many people comply with them, how many people wear that facial covering, how many bars try to get around where we are right now and continue to have lots of people gather, how many people hold house parties in their basement and in their backyard. I believe that these steps should, based on the modeling we've been shown and the reports from the White House, should have a significant impact on bringing cases down in Jefferson County.
Several departments said there's going to be a meeting today to offer more guidance to that happen, and so who was at the meeting and what guidance were they given?
Can you ask me that question again? Local health department on whether there's a meeting where more guidance? Oh, on enforcement. I don't know that we've had that meeting yet, but we'll be working through with them. I know we have had that meeting? Okay, we have had that meeting. We must have provided more guidance. But we need, you know, our local health departments are doing a stellar job. They have more work than has ever been thrown at them by far, but that doesn't mean at this time that we don't have to ask for more. That's where we are, and we need more help out of local and county officials, again, who have been doing a good job, but you know, now's crunch time. Now's the time where we got to get it done, and when we're able to increase capacity again on restaurants, we just need to make sure that we have enforcement, because sadly, when we don't have enough enforcement, those that don't care about doing it right can ruin it for those that are working to do it right.
Senator McConnell unveiled the HEALS Act yesterday, and includes an unemployment bonus scaled back from $600 to expire now to $200, but there's even some turmoil within the party. Some Senate Republicans think that that's even too costly. What are your thoughts on the matter? I know you're not really privy to the
the question is on the new Senate Republican version of, I guess, what we call the new CARES Act. I think they're calling it the HEALS Act, HEALS, if I'm right. Couple things in it. Economists right now are saying that we have an opportunity to rebound, to not be in this recession for an extended period of time, but 2 things must happen. Number 1, we have to keep our unemployment system healthy, and that $600 that is set to expire, is expiring, is critical to keeping our economy in a place where it can bounce back and where people can bounce back. I have concerns about the new number that has set out, and I hope that they will increase it. If it is scaled back from where it is right now, people are not going to get by. And I hope that we can own up to the fact that if $600 on top of just a fraction of your wages is more than you are otherwise making, we are not paying people enough, and we're asking them to already live in poverty. Second piece, though, is it must have state and local government stabilization funds in it. If it does not, the economy does not rebound the way that we need it to. And we can put as much money into opening schools safely as we want, and I am for that. But if we can't afford the teachers that are going to go into the classroom when we can do it safely, then shame on us. And right now, we're still looking at some of the worst budget cuts, if not the worst, that we've ever seen. I think it's early for us to know whether the unemployment piece will hold it up. And I think that when we're talking about public health, we're listening to public health experts. Let's listen to the economists. Let's not shoot ourselves in the foot by our actions on unemployment and make this recession longer for all the businesses that are going to want people out there spending money.
died in Lyon County today. Was that at the Kentucky State Penitentiary?
I believe so.
And also, do you have any kind of update on how many state prisons have active cases right now, and what measures are being taken to protect inmates there?
We'll do a full update on our corrections institutions tomorrow. I don't have that with me today, but we can get you updated numbers on each and every institution, the numbers we have now, and the steps that we've taken. Again, we follow the model of the Green River Correctional Complex, where we were able to stabilize cases. Now, its layout has made that, its layout allowed for that more so than some that are out there, but again, we believe that active steps are being taken. We're also looking at doing a second round of early releases for those that fall under the same criteria we used before and have fallen into that criteria in the months since we did that first round.
Of course, health departments have faced budget cuts, staff reductions over the last 5 years, I believe. I guess when all of this is said and done, I don't know if it ever will be totally said and done, but what will change for health departments? What do you envision changing?
The question is on health departments that have gone through huge cuts over the last 10 or 15 years. And look at things that went through massive cuts and where we are. Health departments, our unemployment insurance office, all of these areas that when times are good, we act like times will never be bad again. Where if times are good, we just spend what it takes to be prepared for when times are bad. If we keep our systems healthy that are there to help our people when we go through something like this, then our outcomes can be much better and the pain, I think, can be much shorter. We have spent significant CARES funds supporting our local public health departments. I think we're up to $47 million that we've allocated, or I believe it's 47. 40 what? 46 million. I may have to find another million after I said that. But we've got to know moving forward that our local health departments are critical and need to be better funded. And it was even before this virus. They do so many important things for their communities that otherwise some other group was going to have to pick up. So unfortunately, this world seems to be seeing once in every 100-year events more often than once in every 100 years. My hope is that we have funding for local health departments to be healthy enough in the future and in future budgets that we can respond in a better way. Also, we know that we've got to keep our systems updated, whether that's our IT infrastructure in unemployment or the new system that we have put in for contact tracing. Now, it's one thing to put in a system for contact tracing, you also have to get people to use it. And it's been difficult to get every local health department on board with using a new system, but we are pushing to get there. But our hope is that we also are investing in the right now in ways that can help us in the future, like with that system that you can use that contact tracing system we're creating for anything else we face in the future that requires that tracing. All right, I thought we were going to get out a little earlier than we did today. We're going to be looking at tomorrow's numbers really carefully. We'll plan to be back here at 4. I believe that if we follow these 4 steps, or if you add one on travel, we won't be Florida, we won't be Arizona. We can save lives and we can rescue our economy, but I need your help. Like Miss Kentucky said, we need you to mask up. We need you to get your kids to mask up. We need you to know that no matter where you are, this virus can spread, but that we now have the tools that tell us how to deal with it. And I hope whatever the reason is that drives you to do the right thing. For me, it's my faith. It's about loving my neighbor as myself. It's about my family, never wanting to bring this home to my kids or to ever transmit it to my parents. That whatever drives you, you show that example that other people see. Because I'll tell you, people, just like some of the questions, they look around, and if you can find somebody who's not doing it, they might not do it either. So please be that positive example of doing the right thing to beat this virus. We're at war. It's going to take all of us, but I know we can win. Thank you all very much. Thank you, Virginia.